Thank you. My name is Joseph Emmanuel. I am presenting on a study that was conducted a year ago on the assessment of quality of life from HIV counseling and social support among people living with HIV clinic attendees in specialty hospital, Yola, Adamawa State. Hello? Can you please move the slide? Hello? Hello, can you move the slide, please? Okay. All right, the topics that's going to be covered in this presentation is the introduction, methodology, results, conclusion, and recommendation. The introduction goes like this, that is actually a study that was meant to assess the quality of life from HIV counseling and social support among people living with HIV clinic, in specialist hospital, Yola. Looking at the quality of life, which is the term which is popularly used to convey an overall sense of well-being, and it includes aspects such as happiness, dissatisfaction with life, thereby promoting and improving the quality of life of those clients that were studied upon. The methodology used was a descriptive research. Primary and secondary sources of information gathering was used to aid the completion of this study. Then data were collected using structured questionnaire, where a total of about 370 randomly selected people living with HIV, adults from the ages of 18 years and above, that are attending clinic within the hospital, were part of the study, and they actually participated in the study. The respondents were not actually required to write their names on the questionnaire. Data was analyzed using the IBM SPSS 21.0, and Pearson's correlation was used between relevant variables, while linear regression was used to predict the outcome. Like I mentioned before, as a descriptive statistics was also used to analyze the demographic variables, while tables and charts were used for the presentation of results. Statistical significance of the study was set at 0.05 p-value. The result was actually, I brought it out in narrative, as the study revealed some correct information, knowledge, and awareness about basic information, HIV, and social support, which were very crucial to improving the behavioral skills and increase the level of confidence among people living with HIV to perform adherence behavior. Then treatment adherence was very significant, dependent on the level of information, social support, and self-efficacy among the people living with HIV, as observed from the study. The quality of life of the people living with HIV, on the other hand, as we all know, is significantly dependent on positive treatment adherence behavior. And then this includes adherence to medication, proper dosing, keeping to clinical appointments, including appointment for their refills, including appointments for viral load and CD4. And of course, coping with stigma among others. Finally, the information, social support, and adherence significantly improve the quality of life of people living with HIV clinic attendees, specialists, where the study was conducted. Conclusively, the result was actually consistent with suggestions of an IMB, that is the information, motivation, and behavioral skill model, that health-related information and self-motivation and self-efficacy are important determinants of an individual's health behavior, as formally as conducted by Fisher et al. In 2003. It implies that if a person is well informed, effectively motivated to act by the social support he receives, he is more likely to develop the enabling skills and confidence required to initiate and maintain health-enhancing behavior that will improve his quality of life. Previous studies which subjected the IMB model to an empirical test also identified significant relationships between variables under consideration in this study and observed that people living with HIV need both accurate information as well as social support to enhance their adherence behavioral skills, which will culminate into optimal adherence. The study implies that more informed PLHIVs are about their ailment, the more social services they are likely to be aware of, and vice versa. To improve the level of adherence of people living with HIV, there must be an uninterrupted channel through which they can access latest information on new trends and changes in their illness. About 2 recommendations were actually drafted, which include, about 4 recommendations were actually drafted, which include health planners. That was actually for health planners and support groups, caregivers should be more intentional in designing and implementing programs that will improve the level of social support for people living with HIV, receive and their understanding of basic issues pertaining to their illness, which will in turn improve their treatment and ultimately their quality of life. Since people living with HIV are likely to spend more of their time with relatives at home, of course, they come into the facility mostly to spend maximum of 5 hours and spend more than 1,400 hours outside the facility that is within the community. It is recommended that training on effective management of people living with HIV given to health practitioners be extended to relatives caring for those infected persons. That this will also improve the quality of support PLHIV of people living with HIV will receive from homes and also reduce stigmatization from caregivers, which seem to be presently very common in the Adamawa community. Then finally, considering the level of unemployment observed among people living with HIV from this study, some sort of empowerment to enable them meet up with their financial needs that will also go a long way in making them busy, thereby reducing redundancy.
Yeah, Mr. Joseph, thank you for